And then the third one is we have to administer the food. Administer a tube feeding or the tube. A food in the tube. So the purpose of this one is to restore or maintain the nutritional status of the patient while using a tube.
So for the materials and equipment, so we're going to check for correct amount of the feeding solution, tube feeding pump or the infusion pump or the tummy syringe, feeding bag or pre-filled tube feeding, emesis basin, and then your disposable gloves, which I'm wearing right now, and then measuring container which to pour the feeding if using the open system, and then you're going to have water 60 ml, stethoscope, the clamp or the Hoffman or butterfly, okay, and then disposable pad or towel which is in the patient already, and then you also need some sterile gloves or sterile gauze and a rubber band which we clamp for the patient. Okay, this is a sterile clamp and the clamp. And then now let's go for the assessment.
Following the basic guidelines of the nursing process, for the assessment, we're going to assess for any clinical signs of malnutrition, dehydration, check for any allergies with the food, and then check for the presence of bowel sounds. For any problems, you have to suggest the lack of tolerance of the previous feedings, and then determine the type of amount and frequency of the feedings and tolerance of the previous feedings. And then for your planning, gather your equipment and materials.
So for the implementation of the procedure proper, first thing you're going to do is introduce yourself and verify the client's identity using the agency protocol, and then explain the procedure to the client. Make sure to inform the client that the feeding should not cause any discomfort but may cause a feeling of fullness. And then you have to perform also on hand hygiene and don your wear gloves, which is optional. And then provide privacy for this procedure if the client desires it. And then assist the patient to make sure in the Fowler's position, in bed or sitting position in a chair, in the normal position for eating. If sitting position is contraindicated, a slightly elevated right side lying position is accepted. Then you can now unpin the tube from the client's gown and assess tube placement by injecting 10 to 30 ml of air from the syringe. Okay, which now I'm doing the injecting. And then using a stethoscope, you have to, when you are injecting, make sure to listen for injecting 30 ml of air from the syringe while listening to gurgling sound using your stethoscope. So now I'm injecting the air to the clients, then I will get the stethoscope to listen for the gurgling sound. And then make sure also to assess for residual feeding contents. If the tube is placed in the stomach, make sure to aspirate all contents and measure the amount before administering the feeding. If 100 ml or more is withdrawn, make sure to check within the nurse in charge or refer to the agency policy before proceeding. And then or reinstill the gastric contents in the stomach if this is the agency policy. Okay. And then now administer the feeding. Before administering a feeding, check the expiration date of the feeding and warm feeding to the room temperature. You have to make sure that one to avoid any intoxication of the food and other. Now you will put now the food in there. Okay. Then we have now the feeding system. We're now using for the system. So for the first system that we're going to use is feeding bag CO or the open system. We're hanging the labeled bag from an infusion pole about 30 to centimeter or 12 inches above the tube's point of insertion into the client's clamp. The tubing, and then add the formula to the bag. Then open the clamp to run the formula through the tubing and reclamp the tube. Then make sure to attach the bag to the feeding tube and regulate the drip by adjusting the clamp to the drop factor of the bag. And then you can now add 30 to 60 ml or 1 to 2 ounces of water to the feeding bag when feeding is almost complete, and allow it to run through the tube. Then you can clamp the tubing immediately after water has been instilled. Make sure to disconnect from the tube and then clamp tube cover with a gauze secure with a rubber band. And then for The second one is the syringe, or this is also an open system. For the syringe naman, we have to remove the plunger from the syringe and connect the syringe to a pinch or clamp nasogastric tube. Add the feeding to the syringe barrel. Permit the feeding to flow in slowly at the prescribed rate, and then rise or lower the syringe to adjust the flow as needed. Then pinch or clamp the tubing to stop the flow for a minute if the client experiences discomfort. Then do not let the syringe empty while introducing the nourishment. Introduce now 30 to 60 ml of water into the tube after the nourishment is introduced. Clamp the tube immediately after the nourishment and water are instilled. Disconnect now the syringe and cover end of tubing with gauze secured with rubber band. And then the third one is the pre-filled bottle with drip chamber or the closed system. This type naman is by doing this is to remove the screw-on cap from the container and attach the administration set with the drip chamber and tubing. Then close the clamp on the tubing, hang and the container on intravenous pole about 30 cm or 12 inches above the tube's insertion point in the client. And then squeeze the drip chamber to fill it 1/3 to 1/2 of its capacity. Open now the tubing clamp, run the formula through the tubing and reclamp the tube. Attach the feeding tube, set tubing to the feeding tube and regulate the drip rate to deliver the feeding over the desired length at the time attached to the feeding pump. Then flush the feeding tube before all the formula has run through the tubing. Then instill 30 to 60 ml of water to the feeding tube. Clamp the feeding tube before all of the water is instilled. And then make sure to add water before the feeding solution has drained from the neck of the syringe or from the tubing of an administration set. Make sure also to ensure the client comfort and safety. Secure the tubing to the client's gown and ask the client to remain in a sitting upright Fowler's position or in a slightly elevated right lateral position for at least 30 minutes. Check the agency policy on the frequency of changing the nasogastric tube. Then lastly is to dispose equipment and appropriately. If the equipment is to be reused, make sure to wash it thoroughly with soap and water so that it is ready for the reuse.
Our evaluation, we're going to evaluate the patient's tolerance to the feeding bowel sounds, regurgitation, and feelings of fullness, and after feedings, weight gain or weight lost. Okay, for the documentation, make sure to record all relevant information. Document also the feeding, including the amount, the kind of food or solution taken, duration of the feedings, assessment of the client. Record the volume of the feeding and the water administered on the client's intake and output record.